Welcome. You are watching Eagle News America. Thank you so much for joining us. I'm Eric Ramirez, coming to you from Washington, D.C. Tonight we have updates from several of our correspondents in North and South America. May Davila in Ciudad de Panama reports about commercial flights in Panama resuming on October 12th. Thomas Likeness in Edmonton, Alberta.
Canada's Prime Minister pleads with Canadians to take a second wave of COVID-19 seriously.
I'm Lynn Ramos in Washington, D.C.
First, Trump-Biden debate tackles COVID-19, Supreme Court, and race and violence in U.S. cities.
May Ann Manzano Guerzon in Sicklerville, New Jersey. May Ann reports on quarantine advisory for those traveling to New Jersey, updates total to 35 states, territories. Myla Simbulan in Swarthmore, Pennsylvania.
COVID-19 exposure notification app called COVID Alert PA, now available for download.
Trendel Teheran in Seattle, Washington.
Study says Washington ranks #1 in best states for working families amid pandemic.
Don Omar Cuevas in Little Rock, Arkansas reports about Governor Hutchinson declaring success of antigen testing and encouraging growth of fintech in Arkansas. Randy Bayuga in Parisburg, Ohio.
Ohio to reopen self-serve food stations.
Julian Fiesta in Delano, California.
Los Angeles offers free flu shots to residents to prevent a possible twindemic.
Our coverage begins now. First, an overview of the COVID-19 situation. According to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 3 p.m. Eastern Time Wednesday, September 23rd, the number of cases of COVID-19 reported worldwide is now more than 31,700,000. Top 3 countries with reported cases: U.S. has 6.9 million, India has 5.6 million, and Brazil with 4.5 million. The virus has claimed more than 972,000 lives worldwide. Top 3 countries with reported COVID-19 related deaths: U.S. has more than 201,000, Brazil has more than 138,000, India more than 90,000. The president of the Pan American Health Organization, Carissa Etienne, at a press briefing regarding the fight against COVID-19 says all hope cannot be pinned on vaccines alone. Let's take a look.
But this virus will continue to spread and people will continue to get sick even as a vaccine is being rolled out. So we cannot pin all our hope on vaccines alone. As is the case very often in public health, there are no silver bullets.
Meanwhile, the United Nations said Wednesday the coronavirus pandemic is taking a heavier toll on jobs than previously feared, with hundreds of millions of jobs lost and workers suffering a massive drop in earnings. In a fresh study, the International Labour Organization, or ILO, found that by the mid-year point, global working hours had declined by 17.3% compared to last December, equivalent to nearly 500 million full-time jobs. That is nearly 100 million more job equivalents than the number forecast by the ILO back in June, when it expected 14% of working hours to be lost by the end of the second 3-month period of the year. ILO Chief Guy Ryder says the impact has been catastrophic, pointing out that global labor income had shrunk by 10.7% during the first 9 months of the year compared to the same period in 2019.
We estimate that the global loss in working hours in the first 9 months of 2020 has been considerably larger than we estimated in the last 5th edition of the Monitor that was issued at the end of June. We present 3 possible scenarios for the fourth quarter and the baseline scenario now projects that 8.6% of global working time will be lost, and that corresponds to 245 million full-time job equivalents.
The ILO said that amounts to a drop of some $3.5 trillion, or 5.5% of the overall global gross domestic product, or GDP.
Why do we see these significant negative evolutions? Well, one obvious reason is that many countries continue to struggle to get the pandemic under control, and as it persists, well, the employment situation worsens. We estimate in this monitor, once we exclude the impact of government support measures, that global labor income declined by an extraordinary, a massive 10.7% in the first 9 months of 2020. That translates into a loss of 3.5 trillion US dollars, an equivalent of 5.5% of global GDP in the period concerned.
Since surfacing in China late last year, the novel coronavirus has killed nearly 1 million people worldwide out of the more than 31 million infected. In addition to the health challenges, lockdowns, travel restrictions, and other measures taken to rein in the virus have had a devastating impact on jobs and income across the globe. Now we head over to Panama. Commercial flights in Panama will resume on October 12th with mandatory safety protocols set by the Ministerio de Salud. In Ciudad de Panama, May Davila reports.
The Civil Aviation Authority, or AACC, reports the extension of the suspension of all international flights for 19 calendar days that will be counted from 11:59 p.m. on September 22 until 11:59 p.m. on October 11, 2020. The AACC emphasizes the reopening and reactivation of international aviation in Panama as of October 12 must be governed by the protocols established by the Ministerio de Salud. All passengers and airlines, without exceptions, must follow the mandatory guidelines established in a resolution specifying sanitary measures for entering the country. Among the sanitary measures is the presentation to the airline of the test certificate of swab, PCR, or negative antigens with a maximum of 48 hours prior to boarding the flight from the country of origin. Likewise, the passenger must sign an acceptance in the affidavit provided by the airline that states willingness to comply with the sanitary control measures and agreement with the use of the application to monitor the appearance of symptoms. They must also provide the landline of the place or residence where they will stay quarantined. Meanwhile, the document International Airport reports it will continue with controlled operations for the interconnection of international aviation until 11:59 p.m. on October 11. Desde Ciudad de Panama, May Davila, Eagle News, vivimos en tiempos interesantes.
When we come back, updates from our correspondents in Edmonton, Alberta, and Washington, D.C. Eagle News America will return after this break. Stay with us.
Hello there, I'm Alfred, and I'm a graduate of Bachelor of Science in Computer Science, batch of 2008 in New Era University. I'm currently working as an operations analyst in Autodesk.
Hi, I'm Earl Escanio, and I graduated with Bachelor of Science major in Computer Science in 2010. I am a consultant at Trinity Consulting, LLC.
Hi, I'm Ivy Macapagal, Bachelor's of Computer Science graduate, year 2010. I'm currently working as a cybersecurity analyst in one of the largest telco here in New Zealand, Coast Park, NZ.
I'm Frank David Riego, a BS Computer Science graduate here in 2015. As a legal analyst, I am tasked to read U.S. cases, specifically civil torts cases.
I am Melanie Rico Hermosa,
a Bachelor of Science in Computer Science graduate, year 2006.
I'm currently a software quality assurance engineer at FBI Systems here in Maryland, United States.
I'm Renzo Cruz. I'm a graduate of BS Computer Science, year 2012. I'm currently working abroad, and I'm working as a senior cybersecurity consultant who specializes in digital forensics and incident response. And I am part of a national security in one of the countries here in the Middle East.
I am inviting everyone to study at New Era University to legit true grit.
Be brilliant in the new era.
Study now at New Era University.
Excellence,
Discipline,
Service to humanity.
You're watching Eagle News America. I'm Ace Ramirez in Washington, D.C. Canada has entered a second wave of COVID-19 infections. As the number of positive cases rise, Prime Minister Justin Trudeau pleads with the nation to take the situation seriously. Joining us this evening is Alberta Bureau Chief Thomas I. Likeness. Tom?
Well, good evening, Ace. In a rare national television address, Prime Minister Justin Trudeau says this fall is going to be dangerous, a very dangerous time for Canadians, perhaps even worse than the spring when the pandemic began. COVID-19 is once again spreading rapidly throughout the country, more than 1,000 cases a day being reported. Let's put that into context. Just last month, that number was only 300. Well, Trudeau's mincing no words when he describes the situation. He says this isn't the news anyone wanted to hear, adding the second wave of the pandemic is well underway in Canada's 4 largest provinces. I live in one of those. Trudeau begged Canadians to follow public health guidelines, to wear masks, get a flu shot, and use the government's COVID Alert app. That app will tell people when they've been in contact with an infected person. He says this isn't the time for parties or social gatherings. He reminded viewers that they brought COVID-19 under control once before, and they can do it again. The 12-minute speech was long on platitudes but short on specifics. As a matter of fact, Trudeau used the second half of the address to promote his government's legislative agenda, which was tabled earlier today in Parliament. He says the government will continue to provide support for Canadians who've been thrown out of work and for businesses that are having a tough time keeping their doors open. The Prime Minister also says his government will implement a national child care program and promote a green economy as the country tries to rebuild. Whether these proposals will come to fruition will depend on just how much support his government has in Parliament. You know, Trudeau's governing with a minority grip on power. That means the government could fall at any time. It could be defeated by the opposition parties. And that means Canadians will be making a trip to the polls for a fall election. Opposition politicians panned the speech. Conservative leader Erin O'Toole, he's been infected with COVID-19, as a matter of fact, and he was recovering at home when he issued this statement. He says his party has lost faith in the government's handling of the pandemic. As we wait for all of this to play out, I wish you all good health. Remember to take care of others, take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Ace.
Tom, before we let you go, you mentioned that the government of Canada is offering support for Canadians who have been jobless and for businesses that are going under. What kind of support is being offered?
Well, there's been a lot of criticism for that, for the way it was handled. For example, people were given $2,000 a month, no questions asked, if they lost their job due to COVID-19. The problem with that was many minimum wage workers were making more staying at home, and they didn't want to go back to work. Employers had a bit of difficulty relaunching their businesses, trying to get enough people to come back to work. As far as support for businesses that are having difficulty staying open, there are business loans available, but again, there's not a lot of appetite to take on a lot more debt. And debt is a real issue for the government. They spent billions, I think it's around $91 billion on COVID-19 so far, and the meter is still running. So there's a lot of criticism there.
That financial help offered by the government, you said $2,000. That's a little bit too generous compared to the U.S. I think it's only $1,200 for the U.S. You also mentioned in your report that Trudeau is governing with a minority grip on power, meaning the government could be defeated. What do you mean by that?
Okay. The parliamentary system, the way it works, is the Prime Minister is the leader of the party with the most seats in Parliament. If he doesn't have a clear majority of the seats, the other guys could gang up on him and defeat him. That's basically what that means. If he is defeated, he will have to call an election, and given the 30-day campaign period, we'd be going to the polls probably late October, early November.
I see. Thanks for the clarification. Thank you so much, Tom.
Okay. Thank you, Ace, and you take care.
Topics for the first Trump-Biden showdown include COVID-19 pandemic, the Supreme Court, the economy, and race and violence in U.S. cities. In Washington, D.C., Imelin Ramos joins us this evening.
Thank you, Ace. For weather update here in Washington, D.C., we have been feeling the cold air the past few days, ranging from the lowest at 50s to now at 64 degrees Fahrenheit or 18 degrees Celsius. Where has the summer gone? We didn't really get to enjoy the summer heat, Ace. Anyway, back to politics. Based on the average of national polls by Real Clear Politics, Democratic nominee Joe Biden is leading President Donald J. Trump 49.4 to 42.9%. As history has shown, polls can change and a lot can happen between now and Election Day. As the two presidential candidates battle it out in various battleground states, the highly anticipated first debate will be on September 29 at Case Western University in Ohio and will begin at 9 p.m. Eastern Time. This is the first of 3 debates between Trump and Biden. The moderator of this first debate will be Fox News anchor Chris Wallace. What will be the topics of this first debate? The moderator announced Tuesday that the COVID-19 pandemic, the Supreme Court, the economy, and race and violence in U.S. cities will be among the topics on the table. Wallace said the 6 main topics, which also include the integrity of the elections, will be addressed in 15-minute segments. Wallace added, the topics could change to news developments. So if anything new happens between now and the first debate, it could be addressed in the debate. The entire discussion would be 90-minute long. These debates could be an opportunity for both candidates to address the American people and make their case as to why they should be President of the United States. With so many divisive issues facing the country, it would be nice to see how each candidate will address these issues. With so much tension between the two candidates, it will be interesting to see how they interact with one another. I know I'll be watching, and I'm sure many people all across the country, if not the world, are just as eager as I am to see this first debate. In Washington, D.C., I'm Malin Bondoc Ramos. Eagle News, we live in interesting times. Back to you, Ace.
Hi, Malin. Are you enjoying the weather?
I am, but I'm kind of sad because I think I'm still missing the summer heat. I'm really missing the heat.
You mentioned you were not able to enjoy the summer heat. What were your activities? Did you go to the beach?
We were just here in the house because of the lockdown. But we were fortunate enough to visit Ocean City last week. It's so cold though. I would have loved to have gone to Ocean City with the 17-degree weather, but yeah, it was at 60s. Not too bad, but it was still cold.
At least you got to enjoy a short getaway before this cold creeps in totally. But going back to your report, we're talking about debates. Do you know when the other two debates will be?
Yes, as the other presidential debates is scheduled for October 15 in Florida and October 22 in Tennessee. Though I'm sure these debates will be informative as well as entertaining, the first debate will probably set the tone for the other two debates. So we'll just see what happens.
How about the VPs? Do they have a debate as well?
Yes, well, Vice President Mike Pence and Democratic Vice Presidential nominee Kamala Harris are scheduled for their debate on October 7. According to debates.org, the debate is set to take place at the University of Utah in Salt Lake City. There are a lot for us to look forward to, Ace.
I see. I'm looking forward to watching these debates as well. Thank you so much for your report.
Thank you, Ace.
Coming up, more updates from our correspondents in Sicklerville, New Jersey, Swarthmore, Pennsylvania, and Seattle, Washington. We will return shortly. Stay with us. This is Eagle News America.
Ein sonniger Tag heute hier in Berlin vor dem Bundestag. Ich bin Irene Juliet Arzadon und möchte diese Gelegenheit nutzen, um ein paar Worte mit euch zu teilen. An alle Menschen da draußen. In dieser Zeit lasst uns nicht vergessen, den Menschen zu danken, die ihr Leben für uns opfern. Sei es die Menschen, die im Krankenhaus arbeiten, in den Altenheimen sowie in den Arztpraxen, aber auch an die Menschen, die im Lebensmittelhandel sich befinden. Die Kassierer. Manchmal reicht es aus, um ihnen ein freundliches Lächeln zu geben. Denn die Menschen, die heute am Arbeiten sind, weil sie nicht so wie einige von uns zu Hause bleiben können, die sollten wir wertschätzen. Ihnen sollten wir unseren Dank ausrichten. Darum lasst uns noch mehr zusammenhalten. Sie wertschätzen.
Well, I think I'm going out of mind.
Efraim Montes po. Mga bro, ayusin nyo naman ang tono at kanta nyo dyan.
Ang binula na po. Ma'am sir, swabe boses ko, di ba? Baka siya. Ako. Hello, Mans. Joel Trinidad po. Baka ito.
Eh di ako na. Lord Mendoza po. Ang malayelong boses sa lahat. O Ege. Ege ka. Bahala ka sa buhay mo. Ege.
Makigulo!
Makitawa! At makipagkantahan kasama natin ang ating mga OFW dito lang sa
Kesaya Saya!
As fears of a second wave of COVID-19 loom, New Jersey updates its quarantine advisory for those traveling to the state to 35 states and territories. Eagle News correspondent May Ann Manzano Guerzon with the details.
Thank you, Ace. In a report released by the Office of the Governor, Phil Murphy, today, he advised individuals traveling to New Jersey from states or territories with significant community spread of COVID-19 to quarantine for a 14-day period from the time of last contact within the identified state or territory. The updated advisory includes 5 additional states: Arizona, Minnesota, Nevada, Rhode Island, and Wyoming, bringing the total to 35 states and territories. The travel advisory applies to any person arriving from a state or territory with a positive test rate higher than 10 per 100,000 residents, or a state with a 10% or higher positivity rate over a 7-day rolling average. As of Tuesday, September 22, there are currently 35 states and territories that meet the criteria stated above. Governor Murphy said to maintain the steady progress of the road back, we must continue to be vigilant and practice personal responsibility to reduce the potential for outbreaks. He also added that it remains critically important for anyone arriving to New Jersey from these 35 states and territories to get tested for COVID-19 and self-quarantine for 14 days. Travelers and those residents who are returning from impacted states should self-quarantine at their home, hotel, or other temporary lodging. Individuals should leave the place of self-quarantine only to seek medical care or treatment, or to obtain food and other essential items. It is expected that individuals will follow the public health advisory to self-quarantine, and the list of these states or territories will be updated on a rolling basis. Meanwhile, here is today's statistical report of New Jersey's COVID-19 cases. According to the Department of Health of New Jersey, there are 430 new positive cases reported today, bringing a statewide total of 200,988 New Jerseyans tested positive. Sadly, we have 7 new deaths, pushing the total to 14,291 fatalities. New Jersey remains on stage 2 of its road to recovery. And as for some weather update, it's now 10:01 in the evening here in New Jersey, and it's currently clear. It is 63 degrees Fahrenheit or 17 degrees Celsius. The high today was forecast as 78 degrees Fahrenheit or 26 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News. We live in interesting times. Back to you, Ace.
Okay, May Ann, you said in your report it's critically important for anyone arriving to New Jersey from these 35 states and territories to get tested. What if they don't? They travel outside and they come back and they don't get tested. What happens?
Well, Ace, I guess this report answered that because it is not mandatory. It is only an advisory to these people traveling in and out of New Jersey to get tested. So the government, most especially Governor Murphy, is actually pleading that to have a personal, sense of responsibility, that if you are to come here in New Jersey or out of New Jersey and come back, you have to do your part and get tested. Ace?
Does New Jersey also restrict travels between the 21 counties in your state?
Well, Ace, it doesn't. I can imagine that would be very tough. But if it did, according to a report from NJ.com that I've read, if New Jersey actually did restrict travels between 21 counties and apply the criteria that was given to these territories and states, 2 out of the 21 A's would be on the list of quarantine advisory, and those are the counties of Gloucester and Ocean. So and Gloucester actually is just a neighboring county of mine. I'm from Camden County, and Gloucester is just like literally the next county from us. So it would be tough if this travel advisory would be implemented within the 21 counties.
That is true. That is true. And even if you implement that, if it's only an advisory for them to be tested or quarantine themselves for 2 weeks, it would still, the impact would still not be that great. Okay. Well, most of the states are experiencing a second wave of this COVID. Most likely, New Jersey will have another one. How do you feel about this?
Well, it was actually asked from the health commissioner of New Jersey, Judy Persicelli, if the increase in our cases is considered a second wave. And she said they're not announcing or considering it yet as a second wave because they're actually not seeing that such a great impact. We are still on the right numbers. So if we will experience that, hopefully not, maybe it's because of the opening of schools and because of the hybrid system. But yes, again, hopefully not. And right now, the government or the Department of Health of New Jersey at least is not saying, not yet, that we are experiencing a second wave. Ace?
Correct me if I'm wrong, New Jersey hits 200,000 recorded COVID-19 cases.
Yes, Ace.
And you being a mother of a 1-year-old, a 2-year-old, how does this affect you?
It's unfortunate that majority of the cases actually is in the north. We're lucky here in the south that only a portion of these 200,000 is from here. But of course, we are also concerned of our families and friends and other members of the community here in the north. Well, it's scary, to be honest, but at least we are seeing outside when we're going grocery shopping, going to pharmacies and all that, we are seeing that a lot of people, or all actually, are complying with the masking up and then so practicing social distancing, and of course to always maintain or limit your activities as much as possible. So don't go out yet, limit your activities, and don't be in like parties like what is being recorded from the Ocean County. So that's very unfortunate, is that what's triggering the spike according to the report is actually house parties from the county of Ocean. So yeah, it's scary, but I have the belief in our in the state, we are complying and we're doing okay. Ace?
Thank you so much, Mayan. Be safe out there.
Thank you, you too.
As part of its contact tracing effort, Pennsylvania announces that the coronavirus exposure notification app called COVID Alert PA is now available for download. In Swarthmore, Bureau Chief Myla Simbulan reports.
Thanks, Ace. Last August, we reported about a pandemic contact tracing technology created by Apple and Google that will help fight the spread of the virus. The wait is over, and COVID Alert PA app is now available. You can download it on your smartphones on either Apple App Store or Google Play Store. It is available on both English and Spanish. Here's Governor of Pennsylvania Tom Wolf with the announcement. Take a look.
That virus is out to get us, and we need to make sure that we're doing what we can. And so today, Dr. Levine and I are proud to announce the launch of a mobile app, COVID-19 Alert PA, which is a mobile app that you can use to fight the COVID-19 virus every day. It's an app that uses Bluetooth technology to help identify individuals who may have been in close contact with someone else who tested positive for the COVID-19 virus. Unlike traditional contact tracing, however, it does not require you to know the person you might have come in contact with. Now,
COVID-19 Alert PA uses exposure notification system technology. It's a joint project by Apple and Google. The app can detect if you have been in close contact with another user who later tested positive for COVID-19 and will send a notification to your phone called a COVID-19 exposure alert. If you tap on the notification, you will be given public health guidance on what to do next. In addition, the app will provide users with the latest information on COVID-19 in Pennsylvania from the department's COVID-19 data dashboard. Here's Department of Health Secretary Dr. Rachel Levine to give us more insight on what this app can do. Take a look.
COVID Alert PA helps notify you if you have been in close contact with a person who later tests positive for COVID-19. And we have built in additional features to help you stay up to date on the latest data on the pandemic. It also helps keep track of how you're feeling each day and connects you to resources if you need help. So here's how. If you get a notification on your phone that you have come into contact with someone who has tested positive for COVID-19, you can choose to send us your phone number to get a call back from someone on our team to speak with you about how you are feeling and whether or not you should be tested. You can use the symptom check-in on the app to help remember how you've been feeling and whether or not you might have symptoms that are consistent with COVID-19. And you can find testing locations if you need to be tested. Now, when you receive, or if you receive, an exposure alert, we actually, as the governor said, will not be able to tell you who you came into contact with that tested positive. It is anonymous. Apple and Google were very specific when building this technology to ensure that your privacy is protected.
In addition to Dr. Levine's explanation when it comes to privacy, which I think many are also concerned about, the app does not enable any location services or tracks anyone and is designed to be completely anonymous. The exposure notification system works by using Bluetooth low energy, which allows phones with the app to recognize when it is close to another phone. Proximity is the only thing measured between phones and not your location. So what are the challenges or pitfalls that the current contact tracing is experiencing that this app might be able to resolve? Here's Philadelphia Health Commissioner Dr. Thomas Farley.
So right now, we try to do that in the Philadelphia Health Department through contact tracing. The way that works is if someone has the infection, they'll get a phone call from one of our workers to find out who that they may have exposed, find out who they may have been exposed, and then our worker calls those people, we refer to as contacts, to tell them they should go in quarantine. It's a good process, but it is not a perfect process. Many of the people who we interview don't know the names or don't know the phone numbers of the people that they may have exposed. Some of them may know them, but they may be reluctant to tell us of those names. And some people that they've exposed, we simply can't reach. We can't get them on the telephone. This app can fill in those gaps. It sends messages to people who are not known by or not named by the person with the infection. And then people then receiving the messages then can take steps to protect their own health and protect the health of their family.
So to those Pennsylvanians out there, download the app, and you don't know, people who use, the more people who download this app, the more successful the efforts can be. In Swarthmore, Pennsylvania, Myla Simbulan, Eagle News, we live in interesting times. Back to you, Ace.
Myla, before we let you go, for lay members like me, I don't understand. I'm not a techie. So what is exposure notification technology? What does that mean?
So ACE exposure notification technology is the it's like I said, it's a joint project of both Apple and Google. They both put together their efforts to build this kind of technology. This technology aims to help public authorities to fight COVID-19. So let's say in Pennsylvania we have COVID Alert PA, and Delaware has COVID Alert DE. State near me, they have also another app called COVID Alert DE. There are two different apps, but they're using the same technology, this exposure notification technology. So how does it work? Let's say you and another person is on a train, inside the train, and then eventually that person found out that he or she is infected with COVID-19. So, and that person fortunately has the app installed on his phone, and you have also the app on the phone. And on the train, you were sitting really close to each other, although, you know, there's still social distancing. So what will happen is, because of the proximity between you and that person who later, like say after a few days, was infected with COVID-19, you will be alerted on your phone that there will be an alert going to your phone saying that you have been in close contact a person who's infected with COVID-19. So there are things that you need to do so that to make sure that you are not infected, or whether for you to know whether you're infected or not. So that's exposure. That's what exposure notification technology is all about. And that same technology is used by different states now. The first state that has this technology, it was Virginia. So and since they're almost the same, in I believe in October, New Jersey and New York will be having their own version of apps, and those will be interconnected. Ace?
Okay, all right, so let's take a step back. Okay, so if I'm from Pennsylvania, I travel to New Jersey or Delaware, will the app work?
Ace, yes, it will work. And that's a very interesting question, because I myself, I work in Delaware, although right now I'm working from home, but I live in Pennsylvania, I work in Delaware, and as sometimes I go to Delaware. And since they're using the same technology, since their app is interconnected, yes, it will still work when you go to DE, and any person who has a COVID Alert DE app on their phone will also be able to use it. It will also work when they go to Pennsylvania. And hopefully in the future, in October, New Jersey and New York will be also connected to both the PA and Delaware apps. Ace?
I see. So personally, would you use the app?
I actually already downloaded the app once I found out that it's available. Yeah. And yeah, the one that you see on the screen, that's me. That was me playing with the app. So I'm trying to figure out how it works. And yeah, it will give you a lot of data. I don't need to go look for the dashboard, because I usually, for reporting purposes, sometimes I look at the dashboard, and I don't need to go to the link. It's already there. You can find the COVID-19 dashboard in there. It will give you a lot of information. Ace?
All right, thank you. Well, one last question, because I can already hear a lot of apprehension from a lot of people regarding the use of this app. Let's say you get a notification, hey, you have COVID-19. How would you react? Right?
Well, the notification will just tell you, hey, someone near you is positive for COVID-19. Of course, you will be startled. And the next question that would be on your mind is, what should I do? And the good thing is the app will also tell you what's the next step, so that you won't be scared. Of course, the next step will be for you to go to the nearest testing site, right? So yeah, those things, the app will help you. And like what Dr. Rachel Levin mentioned, if you provide them your phone number, they can call you and tell you what are the next steps after you were notified. Ace?
I see. Very good. I guess in this case, information is gold. All right. All right. Well, thank you so much for your report, Myla. Be safe. All right.
Thanks, Ace. You too.
Reports from Seattle, Washington, Little Rock, Arkansas, Parisburg, Ohio, and Delano, California. That's next. We will return shortly. Stay with us. This is Eagle News America.
The New Era University, in its 45th year of excellence, discipline, and service to humanity, will offer online education all levels beginning this first semester academic year 2020 to 2021 through the NEU Virtual Learning Environment, or NEU VLE. New Era University offers a complete basic education cycle from kindergarten up to senior high school, offering all strands. NEU has 18 colleges, and 2 graduate schools. It also offers ALS, and ETM. Best of all, NEU has the most affordable tuition fees among private universities in the Philippines. NEU is at Quezon City, the city of San Fernando, Pampanga, General Santos City, South Cotabato, Lipa City, Batangas, and Pinugay, Baras, Rizal.
New Era University is under the stewardship of Dr. Dilo L. Rosas.
What are you waiting for? Be part of the new normal. Enroll now. Classes start on October 5, 2020.
A study by Oxfam America states that Washington ranks #1 in the best state for working families amid the COVID-19 pandemic. In Seattle, Bureau Chief Frendel Fejeran reports.
Thank you, Ace. If we could recollect, Washington was the first state to have a positive COVID-19 case, which brought upon a magnifying glass on the development of our COVID-19 situation. As of this month, Oxfam America sent out a press release that has given light to Washington. No, not for COVID-19 cases, but as the #1 state for working families during the pandemic. Who is Oxfam America? What are the key indicators that Washington state blew out of the water by a margin of a couple of points? It was a close call amongst the other states, but Washington still came out on top. Oxfam America's belief is that the culprit of poverty is injustice. Therefore, if injustice could be omitted, so could poverty. This organization has an intensive history that started back in 1942, which was prompted by the plight of refugees in Greece. Oxfam supplied materials and financial aid to organizations or groups that service the needs of the poor throughout Europe. Now, as the situation in Europe improved, Oxfam turned their attention to the needy in developing countries throughout the world. Oxfam is located in Washington, D.C. and been there since 1973. So as you can see, this organization has been established many, many years ago. They know exactly what they're doing. And not only are they helping the needy, they bring forth, bring aid to the world. In 2018, they have decided to embark on a project, Best States to Work Index, as they take notice of policies taking a significant effect on workers' lives. Now, the index evaluates how each state is doing in assisting working families manage and survive via worker protections, healthcare, and unemployment supports. Now, once COVID-19 hit, the landscape of the working families have taken a complete shift. This was noticed right away as Oxfam was conducting their 2020 survey. Now, earlier this month, the Washington Governor's Office released an article about the outcome of Oxfam's Best State to Work Index. Just like in 2018, Washington State was once again ranked #1 state for working families. Each state or territory earns a score from 0 to 100 for each of the three areas which they evaluate. Now, which are total to create the overall score. There are no states nor territories that have scored over 80. Washington scored 76.41 with its highest score in worker protections. Now, what are some of the efforts highlighted in this report? Mandatory face coverings and PPE, moratorium on evictions during the pandemic, relief from utility shutoffs, increased food assistance, funding for undocumented workers, paid family and medical leave program. Governor Inslee reassures the states that he recognizes the work is not yet done and that workers are facing challenges at their workplace. Governor Inslee expresses his commitment to work and serve now and through to beyond this pandemic. Washington State serves as an example that amid difficulty, when there is compliance to new policies as a state, we could still rise to the top. Seattle, Washington, Frendel Fejeran, Eagle News. We live in interesting times. Back to you, Ace.
Frendel, tell us more about the efforts highlighted in this report.
Okay, so the efforts that were highlighted are the usage of mandatory face coverings and PPE in the workplace, which all of the employees have been compliant, which is excellent. And the funding for family and medical leave programs is it's essential, right? Because if our family member gets sick, we need to have that assurance that we can be home with our family to take care of them and not have to worry about finances. And also, they were able to fund undocumented workers as well. So the state is not leaving anyone behind. There are resources, there has been resources for the working families as they need it. It doesn't just come to their doorstep. They would have to make the effort to apply for these programs. Ace?
I see. What percentage of the overall score does the 3 policy areas make up?
Excellent question. So the index analyzes 3 policy areas when ranking each state. So worker protections, which is 45% of a state's overall score, healthcare, 20%, and unemployment support, which is 35%. Now, all the data that we briefly reviewed with you is based on policies and laws in effect between February 15, 2020, up until July 1st of 2020. Ace?
I'm sure there are states following the footsteps of Washington State. Who are these?
All right. Well, first, Ace, I wanted to ask you, what state do you reside in again?
Maryland.
Okay, so Maryland is not one of those states, but the 4 states that are following Washington is New Jersey, which they came up to be number 2. So yes, Mayan is in New Jersey. They have a score of 72.17. California with 72.03. Massachusetts, 71.66, and Connecticut, 64.04. Ace?
I see. Thank you so much for your report, Frenda. Take care.
Thank you so much.
Progressing toward a safe reopening, Ohio has just announced the reopening of self-serve food stations. In Pearisburg, Granny Bayuga reports.
Thank you, Ace. Ohio's continued progress brings Ohio closer to returning to pre-pandemic life. Today, the governor announced that the order to reopen self-serve stations, food stations, has been signed by Ohio Department of Health Interim Director Lance Himes. This now allows all restaurants, bars, banquets, and catering facilities to reopen. Live entertainment is also allowed in those facilities. Obviously, there are requirements. They must continue to follow workplace safety and to continue to enforce social distancing for their patrons. Today, Governor Mike DeWine tweets Ohio's positivity rate, which dropped to 2.9%. The positivity rate reflects the number of people who test positive for the COVID virus versus or divided by the total number of tests taken. At its peak in April 20, Ohio's positivity rate was at 23.6%. It went down to 3.7% by early September. Although Ohio has made great progress, Governor Mike DeWine continues to spread the word on the importance of wearing masks.
Fighting against COVID-19. I wear my mask, practice social distancing, wash my hands often to protect myself, my family, and my fellow Ohioans. We will get through this. We're strong, we're Ohioans, we're Buckeyes. And together as Buckeyes, we can do this.
As an update to Ohio's COVID-19 key indicators, there are now a total of 146,753 confirmed cases of COVID-19. Sadly, there were the total number of deaths is at 4,687, and the number of hospitalizations at 14,177, and ICU admissions at 3,218. Travel advisory for Ohio. Those entering Ohio from the states that are recommended to those entering Ohio from these states are recommended to self-quarantine for 14 days. Ohio Department of Health travel advisory are for states whose positivity rate is 15% or higher. They are also recommended against travel to such states. South Dakota is at 17.9%, Idaho at 17.5%, Wisconsin at 17.3%, Iowa at 15.8%, and Kansas at 15.4%. Perrysburg weather. Currently, it is 23 degrees Celsius here in Perrysburg, Ohio. Today, we saw a high of 26 degrees Celsius, and it was partly sunny. This evening, while we sleep, we will see the temperature drop to a comfortable 12 degrees Celsius. Tomorrow will also be a partly sunny day with a low of 12 degrees Celsius and a high of 27 degrees. Perrysburg, Ohio, Rani Bayuga, Eagle News. We live in interesting times. Back to you, Ace.
Thank you so much, Rani. Be safe, all right? Flu season is coming. To prevent what experts now label as a twindemic, Los Angeles offers free flu shots to residents. This is to avoid an influx of flu and coronavirus cases in hospitals. In Delano, Eagle News correspondent Julianne Fiesta has the details.
Thank you, Ace. Los Angeles offers free flu shots to residents to prevent a possible twindemic. With the flu season coming up in the midst of a pandemic with the COVID-19, Los Angeles is taking the necessary steps to prevent what experts and others are labeling as a possible twindemic, which could lead to many hospitals receiving an influx of flu and coronavirus cases, greatly impacting the city and economy. Los Angeles Mayor Eric Garcetti partners with the University of Southern California, or USC School of Pharmacy, to initiate a pilot program to make flu shots available to Los Angeles residents at designated venues throughout the city. He made this announcement just before having his annual flu shot at the Wingart East LA YMCA in Boyle Heights. Mayor Garcetti stated, quote, "With the COVID-19 pandemic here and the flu season coming, it's more important than ever before to get a flu shot to keep Angelenos healthy and avoid a scenario that could overwhelm our hospital system. Getting a flu shot should be part of everyone's annual routine, and working alongside the USC School of Pharmacy, we will make this life-saving vaccination available more widely, quickly, and efficiently to people across our city."
This is not
The flu shots will be free of any cost to Angelenos with no appointments needed. One can just walk in for a free flu shot. This week, free flu shots were available today at the Wingart East LA YMCA from 8 a.m. to 2 p.m., while for the following weeks, the city will announce other schedules and places wherein residents can avail of these free flu shots. USC School of Pharmacy Dean Vasilios Papadopoulos said, quote, "Pharmacists play an important role in the response to the COVID-19 pandemic, and especially when it comes to vaccinations. It is likely that flu viruses and the virus that causes COVID-19 will both be spreading these coming months. So this year, it is more important than ever to get a flu vaccine. You can safely get a flu vaccine at multiple locations, including your doctor's office and local pharmacies, or you can walk up to a mobile clinic with no appointment necessary. Although everyone is encouraged to receive their annual flu shot, the city reminds the public that those who are positive with COVID-19 or show symptoms of the coronavirus should not receive the flu shot until they have consulted with their physician to ensure that they are better and no longer have the virus, including the completion of the required self-quarantine period. In addition, one must be wearing a mask or cloth face covering and practicing the required physical distancing upon arrival at the mobile flu shot venues. The USC pharmacy staff will screen every person before giving the flu vaccine. Every flu shot site will also adhere to strict precautionary protocols and safety measures, including disinfecting after each vaccination to promote health and protect everyone. In Delano.
This is Eagle America. Thank you so much for joining us. I'm Ace Ramirez. We live in interesting times.